for healthcare for the country. It's not Apollo. Apollo was in the beginning, as you all know. Cardiology, I'm a cardiologist. When I came back from abroad, there was not acceptable cardiac surgery program at that time. So most of our patients had to go abroad. And when he could not do it, I lost a young man who couldn't raise $50,000 to go to US. That's how it rang in me, saying, how many more are going to die because they can't afford this kind of price. Today, we started that time. It was not easy. You all know how many months, how many trips I made to Delhi. And finally, I'm happy that the entire healthcare scenario in the country changed with the few regulatory changes that happened so that healthcare was recognized. Something like an industry. But still we don't get all the benefits of the industry. But what I'm happy is that we still are able to establish more hospitals. From one hospital in Chennai today, we've got 74 hospitals, and another 6 or 8 hospitals are on the way in the next 24 months. But this is, and it's not just Apollo. There are another 300 good hospitals in the country. This is where I told the Prime Minister that you must promote India as a global healthcare destination. And he was very happy, and I gave 8 suggestions what needs to be done. He went one step ahead and said, let's make heal in India and heal by India. And he said, do you know why? I said, yes, I can now guess, because Susmita did 750 BC. He did the medical equipment and medical treatment. So I said, that's fine. He said, let your hospitals cure them, and then they can become well in these centers. So that is being promoted, but it has not caught up with the thing. So I expect once it's fully grown up, India could become global healthcare center, making a significant impact. But what we have seen here, as I said, we couldn't do cardiac surgeries at that time, and because there was not total support, backup support in this technology and the learning technique. I must thank in cardiology we are now probably number 1 in the whole world. Number of cardiac surgeries that were done, probably number 1. I should thank our first surgeon, Dr. Jagannath, who has cost 50,000 cardiac surgeries and trained several, about 40, 50 surgeons, cardiac surgeons, were trained by Jagannath at Apollo Chennai. This is where I'm so happy that it's not just Apollo, but it's given it to the rest of the country so that many more people have got an access. But it's still short. I always say this, that we need to add another 100,000 hospital beds. We need to add 200,000 doctors per year, and 300,000 nurses, and 400,000 technologists. All this was for the global workforce. Even in that, I gave a suggestion to global workforce. I'm happy. Immediately they started acting. They not only improved the number of nursing colleges by over 100, but they increased the strength of a nursing college from 75 to 250. For 20 years, 30 years I've been trying. They got it from 30 to 75. But in one shot, the government this year has said they can admit 250. So I think we'll be ready with the global workforce. The two major things in healthcare today is to make India as a global healthcare destination so that we can give it to the rest of the world. And second is the supply of medical manpower. It's just not the doctors. And equally important, both the surgeons of the saying it's the anesthetist, the perfusionist, the supporting staff, which makes a huge impact in this. And I'm happy that this is where India is proud of. There are 4 things that Apollo is known for. Our clinical excellence. Clinical excellence, whatever we do, you saw in cardiology, cardiac surgery, robotic cardiac surgery today, they both, Prakiti and Joseph showed, they not only done the numbers as the highest numbers in the world, but their quality and outcome of the patient is excellent, far excellent. This is what people look for. First, in the beginning, they come to the hospital to take a care. then automatically then they would want good care, good clinical care. And then the two other things you can't buy with a Jewish marker $1. This is where an Italian or an Indian can give care and compassion. So this is the most often. I still recollect during COVID, one of the famous cine actors, she got discharged. She said, Dr. Reddy, your team gave me back my life, but I'm very happy they looked after me as their own child. They're happy. Our doctors, our feeling was that she was so well taken care of, like a mother looks after the child. So this is what Apollo is. And finally, of course, technological excellence is very, and the cost is very important. On that day, on September 18, 1983, when we opened Apollo, our cardiac surgery program was cost of 5 crores. Today, after 41 years, for an ordinary patient, it's still $5,000 or even less. But our outcomes are better. Our outcomes, our surgical outcome is excellent. But what we are seeing today is far excellent. Both Dr. Yusuf and Satiki, what they have done, they made it saying that our surgical technique is so super and the complications are very minimal and the duration of the hospital. Originally we used to give the patient for 12 days, then made it 11 days, then made it 7 and then now 5 days with improvement of backup. But in this, they are willing to discharge. Satiki one day asked me, can I discharge the patient same day? But they said not same day, it will be 1 day. So they are keeping it. The person said 2 days at the most. That's what's required. Not because the patient needs medical help. At least you get used to it. But this is a very important thing. And I'm very proud of our culture. Our culture to say that whatever is the Apollo culture, whatever is good for the patient, we must adopt it. As you all know, when I put proton, everybody got to be crazy. Even my board said, what is this? One bed you are going to spend 30 crores, 40 crores. I said it's not a number, but that is a necessity which can make a significant impact. And you all know, it took 3 years to give permission, but COVID came, and after COVID now it is picked up. Now it's full. Apollo will put at least 2 or 3 more protons in the next 1 year. This will be, that is because it has made a significant impact. People who are, are told that your time is now maybe 3-4 weeks to live, they are all living after proton for years as a normal person. So this is why I think this technique which Yusuf and Satiki have done should pick up, and all of the centers are now gradually picking up. But maybe a year or 2 from now, we should. It's a little more expensive. It's about 1.5 lakhs more expensive. Patient sometimes thinks of that. He doesn't think that hospital stay is less, the complications is less. So I think this is why the media can make that difference. To tell him, it's not the cost that benefits, it is your health. I always quote this quote by McKinsey. McKinsey said, medical expenditure is not expenditure, it's an investment into your health and happiness at home. So that's where I think I admire Dr. Satiki. I still recollect when he came back after training for robotic surgery, he said, can I have a robot? We gave him a robot in 1 week, 7 days. I diverted it somewhere and do it. Now Yusuf picked it up. Yusuf now is not only training here, he is also training the other centers in Bombay and in Delhi. So I am very sure that this will pick up very rapidly. So that finally the patient, not from the country, I think in the next 5 years, I expect that whoever were going to US before, something like that they should say, for my health care, I should look at India. I should look at India not because of the price. Sometimes they think it's cost effective. care that India gives is not cheap healthcare, it's a cost-effective healthcare with intellectual incentive. I don't have to say about the surgery. Both Yusuf and Satili told you how simple they have made it, what difficult surgery. I still recently had a senior 88-year-old person who came here, and general surgeon said they can't even touch him, he won't be able to stand the surgery because he can't make 4 feet. But they sent him running after 3 days of surgery. I think this is remarkable. This is what's happened to most of these patients, where there is no hope for them. Especially the bad surgeries you have seen, how simple they made it. Previously, a large cut and then recovery, and infection, all sorts of things. They have removed all of this, and I'm sure with this encouragement that they are doing, with these robots, I think at the presentation they did in 2020, we bought the first 3 robots. Today we have about 15 robots, but I hopefully we'll have 150 robots in the next 2 years. But every single surgery, because we are doing everything. You have seen in the beginning, every single organ surgery they have done. And sometimes it's different robots. For the spine, there is a separate robot. For the knee, it's a separate robot. But I think that the robots have made a very clear message, I should say. You saw it very clearly. That vision of the area where we are operating is so nice. And the stitches are so simple. So complications very little. And there is not huge scar. And more importantly, prevention of infection. So with all of these, I think it's necessary for it to grow. We have to give it a full support. I want more and more of them to be trained under them, these 2 champions, for the cardiac surgery. Other surgeries have also picked up very nicely. We are #1 in colorectal surgery, and then minimal invasive surgery. It's not India's #1. It's about top 7 in the world who are doing this number of cardiac surgery. I think that's what makes us feel proud. It's what makes you feel proud and say, what can I do to make this happen? So that India and Indians and the people in the world who come to us can go up to their satisfaction and a wonderful surgery, done so well, recovered so well, and it's costed at very, very cost. So God bless all of you for all the support that you have given us in 2020. It wouldn't have been what we are here. Because if you don't tell, we can't talk. We can't talk about ourselves. Our surgeons can't talk about themselves. Even if they talk, they can talk to the patient. But we are able to speak to the country and probably to the world. This is the next program. Hopefully the government of India will promote that program, promoting Indian healthcare to the world. But already 150 countries, people are coming, but the numbers are short. There's not a number of countries, numbers are short. Okay? This will make a significant impact so that we will continue. One thing I assure you, at always the time, whenever any good technology comes, we will absorb. Even for cancer, last year we put in Delhi a small thing for cancer with neck and head, equipment called ZAP. And it just comes in, no precaution, is an ordinary room. So I think all of this will make a very big impact. And this is why I think we are ready to accept after the equipment is proven. And definitely our people are, the way they can react to themselves and get into new technologies. This is what I am proud of our entire team and proud of all other hospitals. Whenever I talk about our results, we must also say a thing that there are some good hospitals in the country which will make a difference. We need to build more health centers. Government, we paid so many times to ask the government to give some relief. Even GST is charged on healthcare. No other industry pays GST. Healthcare pays GST. There is no no other benefit. USA they used to equipment free. No, today it's at 9%. And it's just budget operated with the 45%. So, but in any case, all are there to support. To support health care. It's not just for you and your family. It is for the family and the country and the world. God bless all of you.